Hello everyone. This presentation is on You Gui Wan, also called Restore the Right Kidney Pill. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, You Gui Wan is classified under tonify. A representative pattern is kidney yang deficiency with coldness, weak low back, frequent urination, and fatigue. Important ingredients include Shu Dai Huang, Shan Yao, Shan Zhu Yu, Gu Kai Zai, Gu Zhang, Tu Si Zai, Lu Jio, Bang Gui, Ru Gui, Fu Zai. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 60-year-old man with diabetes, atrial fibrillation, and chronic pain. The current medicines are metformin, apixaban, sotalol. This case gives a plausible reason to consider You Gui Wan, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Fuzai plus sotalol. The mechanism is, aconite can provoke arrhythmias, while sotalol affects cardiac repolarization. The clinical significance is, potentially life-threatening. My management plan is, avoid without specialist oversight, use only properly processed Fuzai. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Bang Gui plus apixaban. The mechanism is, Bang Gui may add to anticoagulant effects. The clinical significance is, moderate. My management plan is, monitor bleeding and avoid other blood-thinning supplements. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Ru Gui plus metformin. The mechanism is, cinnamon-related compounds may lower glucose. The clinical significance is, low to moderate. My management plan is, monitor glucose during treatment changes. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, You Gui Wan may be reasonable when the patient's presentation matches kidney yang deficiency with coldness, weak low back, frequent urination, and fatigue. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.